Hello, welcome to As Listening Sample 6, Section 3. So we did first questions, so we will answer between 26 and 30. Okay, let me try guess. This time this is getting harder. Okay, before listening, how do scientists block pain nowadays? By understanding mechanism. Okay, understanding something cannot block pain by tolerating is not very scientific too. I think the answer is A. When the patient experiences phantom limb pain, amputation, after the amputation, it is very well known, are peripheral nerves involved in process of feeling pain. Are peripheral nerves involved in process of feeling pain? Sorry, I'm not about the part. I think it's not the answer because they don't ask such question, and I think it is. Yeah, let's try. What's happening in it? Okay, let's try.
Section 3.
Focus in the brain where pain is. So the way we feel pain and the beauty are the two underlying themes of human nature. This obviously is required for any kind of sensation. Pain is just one of those types of sensations.
Parts of the world we want to be able to anaesthetise so that people don't experience the pain of surgery. And we know that there are some states of consciousness where people can undergo quite stimulating and unpleasant to most people experiences such as surgery. But for most people they need to be unconscious, so in a state of anaesthesia.
Okay, I think we should wait now. Okay, let's see. I'm sure about question 27. Are peripheral nerves involved in process of feeling pain? I'm not sure that one. I think if it doesn't involve, they didn't mention. What's happening in a case of phantom limb pain can create
Now listen and answer questions 26 to 30.
It sounds like we have some clues as to how pain works, although there's a lot that we don't know. Is that why it's so difficult to find ways to block it, because we don't really understand the mechanisms particularly well?
I think what we do understand is the kind of area that Natasha works in, which is the sensation of tissue damage by specialised nerves in the skin and the muscle and the viscera, and how those nerves are activated and send electrical signals. So the activity of those nerves is absolutely required for most pain states. And so by focusing on them, we can actually find ways to treat pain without understanding anything about pain perception. And so that's the focus of interest of most pain scientists. And that's where anaesthetists also are working in terms of blocking the drive into the central nervous system. But pain perception itself is completely mysterious.
A good example of this might be one I explain to my patients, which is a phantom limb pain. Listeners might have heard of this already. It's when people can have a painful limb once they've had an amputation. So a person may have had to have an amputation for a medical reason, such as the leg in this case, let's say, might become gangrenous. So that's done under anaesthesia as a surgical procedure. But after the operation and the wound's healed, then people who are unfortunate enough to get this phenomenon can then experience sensations in that leg which has been removed, and not just sensations, that if they've had pain there before, they can often experience pain. So even though the leg's not there, it's no longer physically present, the patient still feels that their leg's there and it can be painful. And of course that's very distressing, and it also gives us the notion that pain is not just in the nerves, the peripheral nerves, the ones in the leg. It's modulated in the brain.
Yeah, if I can come in there.
Yes,
pain has nothing to do with the peripheral nerves. Pain is in the brain. But there's a requirement for nervous input from the periphery in order to feel pain. In almost all states. There are situations where you can get pain after a stroke because you have lesions in your thalamus, and that's obviously some form of central pain syndrome. But almost all inflammatory pain states like rheumatoid arthritis or osteoarthritis or diabetic neuropathy, all these chronic pain states require the activity of peripheral nerves, and that's what we try to block without understanding the perception of the painful stimulus itself.
So Natasha, it's an interesting point that John was saying about us needing stimulation of our nerves sort of throughout our body, our peripheral nerves. So what's happening in the case of phantom limb?
Well, there's several theories, and there's probably not one overarching thing that's happening. We know that pain can create a memory of itself, just like any other experience that people have. You might have, heard some records on the radio recently about David Bowie, for example, and that takes you, listening to that record takes you back to a certain point. So listening to music can take you to a certain point in time, and some sort of stimulation, for example, movement in that limb or something else, which is the peripheral, like John's talking about, that peripheral input can cause a learnt sensation to be re-experienced. It's not that the person's actively trying to recall that painful experience, who would want that, but so it's like anything that's learnt. The nervous system's really, really good at learning things. That's how we've learnt to do all the, the great things that humans and people do in their lives. Unfortunately, it's almost like it can get switched on for some sensations, and then the person continues to feel that pain, even though there's no obvious mechanistic reason for them to continue to feel it.
That is the end of section 3. You now have half a minute to check your answers.
Lower sensation, okay. Lower sensation. Okay, thanks for watching this video, and have a wonderful day.